we were looking into the precursors of genocide in societies around the world. And one of the precursors to that kind of extreme violence is that enhanced sense of victimization, is that genocides occur when you get them before they get you. And you get them before they get you because they're coming for you. And so the populist types who want to capitalize on the genocidal impulse heighten that sense of victimization. And you talked about this unbelievably pathological claim that counselors often make now, much to their eternal shame, I would say, and evidence of their absolutely unprofessional and unwarranted conduct when they tell parents, for example, well, would you rather have a trans child or a dead child? And, the evidence on that front, by the way, to call it thin is to say almost nothing. I mean, the kids who suffer from gender dysphoria, from bodily dysmorphia, let's say, are at higher risk for suicide. But the reason they're at higher risk for suicide actually isn't because of their gender dysphoria or their body dysmorphia. They're at higher risk for suicide is because both of those clinical phenomena are offshoots of an underlying proclivity for depression and anxiety, like a non-specific proclivity for heightened negative emotion. And that's associated broadly with suicidality. Now, what happens in the case of a psychogenic epidemic is that underlying proclivity for negative emotion, that's trait neuroticism, by the way, that's one of its variants, searches for a culturally appropriate form of expression. And that can be modified radically by the culture. And so you see it taking all sorts of different forms in different cultures, but the underlying proclivity is the same. And to attribute the proclivity for suicide to the specific, say, body dysmorphia or gender dysphoria is an absolute misreading of the clinical literature. And plus, there is no evidence that the early hormonal transition and surgical transformation of children decreases their risk for suicide. Like, that's just an outright lie. In fact, the American Psychological Association itself, in their position paper on gender-affirming care, state, it's so funny, they're so pathetic. On one page, they claim that if you don't affirm gender identity, which means lie to children about which sex they are, then you increase the risk of suicide in the long run. And then like 3 pages later, they say, because of the prejudice of the research community, there are really no valid long-term outcome studies on the consequences of gender transformation surgery. It's like, well, you can have one of those guys, but you don't get to have both. If there's no long-term follow-up studies because the research community is prejudiced, and you know what? The clinical research community is not prejudiced. Their whole bloody enterprise is to do long-term research on various psychopathological conditions. Not only are they not prejudiced on the research front, they're the exact opposite of that. But there are no long-term follow-up studies because it's a relatively new phenomena. If there's no long-term follow-up studies, you don't know if at minimum, you don't know if suicide risk is decreased or increased. Now, I would say the broader research indicates, well, you're not going to decrease suicide risk among depressed young people by subjecting them to radical and unwarranted experimental surgery that produces endless numbers of side effects and turns them into the kind of person who has no stable identity whatsoever or any hope of establishing one. So,
yeah, I think right. Yeah, common sense. This is one of those things. Why on this topic and so many others, I tend to be, I guess I have an unscientific view. What you might consider an unscientific view of studies in general. I'm sort of skeptical, at least the way people use studies these days, which is really they just Google whatever conclusion they've already arrived at, and they find a study that, based on a skimming reading of it, affirms that, and then they say, look, studies have proven. I think common sense is we can often use first and foremost in these sorts of situations, and so. Does it make any sense that we would be staving off suicide and giving kids better long-term benefits by having them forfeit parts of themselves that they don't don't even understand yet. Like before you even get to the surgery, when they're on the cross-sex hormones to begin with, now these kids are sterilized. And so they're never going to be able to have kids of their own. And how could you at 14 or 15 years old make that kind of choice? No 14 or 15-year-olds thinking about having kids. When I was 24 years old, I couldn't imagine having kids, and I didn't really want to have kids. A year later, I was married. Now I have 6 kids, and I couldn't be happier that I have them. So when you're young, you're whatever declarations you make about what you want the rest of your life to look like, it's almost meaningless. And so when a 14-year-old says, "Oh yes, I want to," that's fine. I'll be sterilized. I'll be this. I'll have the breast chopped off, and I'll be happy like that for the rest of my life. Anyone who's been around adolescence, anyone who's been an adolescent knows that makes no sense. But the real problem go ahead.
Well, it's also the case is that in principle you're taking an unstable identity, so that's the gender dysphoric identity, and you're transforming it into a stable and functional identity, and that's the new transgender identity. But it's not stable or functional, and the reason it's not functional is because, well, what the hell? How the hell are other people supposed to integrate you into their communities and their lives? So, for example, Chloe Cole, who's a prominent detransitioner who's suing Kaiser Permanente and a variety of other medical practitioners for the butchery that they performed upon her when she was very young, with no clinical assessment to speak of at all. And I know that because I interviewed her to find out how she was assessed, and to call it appalling is to say virtually nothing. She couldn't find anybody to date her in high school, once she had transitioned. And the reason for that's obvious. I mean, it's hard enough for kids to find anybody to date in high school. Lots of kids don't find anybody, even if they're, so-called normal kids. It's not like people are masters of dating when they're in high school. And then, of course, if you're trying to establish a relationship with someone who was a girl and who is now sort of a boy, you have no idea how to conduct yourself. And if you have any sense at all, you're just not going to go there. And besides, you're going to be afraid to go there anyways. And that isn't a consequence of anti-trans prejudice on the part of young people. That's utter foolishness. It's just that it adds a level of insane complexity to a situation that's already too complex for most people to manage. And so what happened to her was that she ended up dating the sexual predators she found online, because they were the only ones who got the right kind of kick out of exploiting someone in her unfortunate situation. And you can blame that if you want to bend your activism to the ultimate degree, and the prejudice that people have on the trans front in our broader society. But the truth of the matter is, the blatant and blunt truth is that we have enough trouble getting along with each other when it's men trying to get along with women, let alone when it's people who are sort of men and maybe partly women trying to get along with other people who are maybe men and sort of partly women. No one knows how to do that, and no one will ever know how to do that.